All right, good evening, everybody. My name is Wolf Krummel, and I would like to welcome you to pharmacogenetics, the introduction to how to make a lot of money with pharmacogenetics, because I really think it's a new revolution in personalized medicine, and we are now at the forefront to kind of bring this to doctors, to specialists who in many, many cases are not even using this technology to help their patients and to save lives. Well, I'm the founder and CEO of Meridian Health Solutions, and we're basically providing pharmacogenetic services, toxicology services, testing for doctors across the country. But let me give you a little bit of background. I've been in internet marketing for over 20 years, have a couple of different companies, run multiple different projects. When it comes down to the online world, that's really my world. And what I can bring to the table is a really good understanding of internet marketing. And we have integrated, as you will see, some really powerful tools that really automate the process of follow-up for you, so you really can focus on calling leads, establish trusted relationships, and bring them to the close, because the close, I believe, is not difficult. We are not asking them for money. There's no monetary exchange. We're simply trying to persuade a doctor to say, look, your patients need help. Here's the information. Here's the documentation. And let's get started, one patient at a time. So let me get started. Why do we perform pharmacogenetics tests? Well, to prevent the likelihood of an ADR. An ADR is an accidental drug reaction. Fatal ADRs are between the 4th and the 6th leading cause of death in the United States. So there's over 106,000 fatal deaths in the United States annually. That's crazy. And even over 2 billion ADRs occur every year with over, as we said, 106,000 cases in death. I mean, that's crazy. And nobody really speaks about it. I mean, you see some segments on the news, they start to explore it, which is great. So we have to overcome one hurdle, which is misinformation and maybe some ignorance in some parts, by simply providing them with the service of telling them why they as a doctor need to utilize pharmacogenetic testing. So, of course, one big part is increases drug efficacy. I don't want to go into the details, but for example, with clopidogrel, it really helps there, and warfarin is another platelet drug that I think what does it do? With the platelets in the blood. So we're testing against these. There are many more medications that the pharmacogenetics testing is helpful for. The next point is that it improves patient medication compliance. So the knowledge of a patient's genetic test results has proven that they will more likely take the medication that is prescribed. So that's really important. Reduce healthcare costs by, of course, preventing ADRs. And an estimated $136 billion are spent every year on treating ADRs. That's crazy. So one of the interesting statistics is that there's a survey that suggests that approximately 40 to 50% of patients who are prescribed the drug do not improve, or worse, suffer adverse drug reactions. And now we have a weapon. Now we can do genetic testing and we can help those patients. So the big question that I always hear from doctors, and it's across the board as well, insurance do not pay for it. I don't want to really get involved until everybody is on board. Well, the good news is that our PGA's testing is being paid for by the insurance companies. Pharmacogenetics testing can determine the appropriate dosage of medication for an individual based on his or her DNA. So rather than using the traditional hit or miss, one-size-fits-all approach, this new science can tailor dosages precisely or determine which drug to choose. So now the doctor can avoid underdosing or overdosing a patient. So we offer a cardiovascular genetic testing panel that can provide physicians really valuable information. So the interesting point is to understand that just like a patient's hair or eye color, how quickly he or she metabolizes medication is determined by their genetics. So a genetic profile can help you adjust a drug dose or type of drug to help prevent harmful side effects or adverse drug reactions and help a patient's medication to be more effective. So here are some of the common drugs. Again, we have clopidogrel, warfarin, all these drugs that when you mention these drugs to a cardiologist, the leads that I have assigned you, you can name drop maybe some of these. Hey doctor, hey nurse, are you prescribing warfarin? Are you prescribing propranolol? And if they say yes, then it's like, well, you need to ensure that you do pharmacogenetic testing with your patients. So we're also testing for hereditary risk factors like factor 2 and factor V. As you start getting into the process of pharmacogenetic testing, there may be certain things you want to read up on once you establish those relationships with nurses and secretaries or medical directors. Many physicians are moving away from the traditional one-size-fits-all approach. So the question you can ask them, are you one of them? The reason for this is the realization that a person's genetics determines how they respond to medications. So everyone has a unique genetic makeup. A medication that works perfectly well for one patient may not work for another. So that's, again, something that the doctor should be aware of. We really need to bring that point across. Again, it's the 4th leading cause of death in the United States. So let's talk about how is this actually done. Genetic tests performed on patients' saliva provide information that physicians can use when prescribing medication. This modern form of medical practice is known as personalized medicine. So that's a term that you will hear more and more in the news as well. Genetic tests fall under the category of pharmacogenetics tests. This type of testing is a scientific approach to understanding your genetic makeup, to assist you in predicting which medications will work best for the patient and what is the proper dosage. So again, this is a little bit of detail that sometimes helps to maybe communicate to the gatekeeper over somebody that's just to kind of break the ice, something to mention like, to educate them on the process, because many times they think it's blood testing or something. It's crazy. The patient's genetic information allows the doctor to determine whether a medication could be an effective treatment. So the labs they're using, we're sending out the doctor a buccal swab or cheek swab. So it's very easy. There's some simple instructions in there. It's a little bit of an onboarding process once the doctor signs up with us. In the near future, once we get rolling, I will have full-time support staff just handling that part for you guys. But initially, this is something that, to bridge the ice, to kind of have that communication is something that we need to communicate. It helps us to kind of really make sure that they do the testing, that they're really onboarded correctly. So the swab now is shipped to one of our labs for analysis. The analysis of the patient's DNA produces a really awesome color-coded report. I will send those and share those with you by tomorrow as well, allowing you to prescribe with confidence so the patient receives the most effective medication doses possible. All right, so what we do is basically leave the clinical decision making to the doctor by offering specific gene and drug selections and multiple methods of testing based on the medical necessity. So our comprehensive testing menus provide an expansive selection of tests to meet the unique needs of individual patients' healthcare, professional treating pain, substance use disorders, and other psychiatric disorders. So we have different kind of panels. Right now, what we're focusing on is on cardiology, because I think that's a really good. I have thousands and thousands of leads that we can call on, so there's plenty of business out there. So let's focus on that first. Pharmacogenetics testing analyzes genetic variants related to the patient's response to medications. We spoke about that. The results provide evidence-based, actionable data that assists clinicians with effective treatment and therapy. All right. So this is pretty much it in a nutshell. We're focusing on cardiologists because we have called on pain doctors, we have called on gynecologists, we have called on internists, and we felt that we got the best response, at least initially, is from cardiologists. I mean, we have some very specific panels. It's very clear that it's absolutely needed in their practice. Even if they do 10 tests a week, that's great. If they do one test a day, that's great. They don't have to do every patient, of course. So this is something, of course, we need to bring across as well. So I want to start jumping into the sales strategy. So we have discovered a lot of information on pharmacogenetic testings, helping saving people's life, 106,000 deaths. So we need to see how can we incorporate that? How can we start that? So first of all, we need a very personalized approach that allows us to really get in touch with them on a personal level. We need to establish trusted relationships. Only with trusted relationships we're able to make a sale. Even in this case, though, we don't, ask somebody for money. We're still asking them to make a big change in their process on how their everyday work goes. You know that doctors' offices are extremely busy. Everybody is stressed. So we're coming in there and introducing another headache, so to speak. So we need to ensure that they understand that this is not a headache. It's easy as 1, 2, 3. Do a little buccal swab, fill out the paperwork, and really help your patients. Of course, the doctor, can bill for that as some kind of a service, but the point is that, we need to bring this across that it's really, really, really simple to implement into their workflow. One of the things that we have implemented is a very powerful automatic information campaign that utilizes email, faxing, and regular snail mail, and I will explain that a little bit later. What we need is we need to qualify leads. So we have leads. Let's go down. Let's qualify them. We have a couple of different options, as I will show you later, how to qualify them. Cold, warm, hot leads, and we'll go into that. Then, of course, we have the consistent follow-up. Well, there is automated consistent follow-up from the information campaign via email and fax, but what I'm talking about is also consistent follow-up from your side. Mark the leads correctly. Mark them as cold, warm, or hot. Cold lead, I would suggest using as somebody that you maybe reach, but you really didn't get anywhere, but it's maybe worth to give them a call back one more time. Nothing urgent. A warm lead, I would suggest thinking about somebody that, you got some information updated. And as I said, I will go through this again a little bit later when we are in the CRM. And mark them as a warm lead. You may be able to update the email address or the fax number. And the hot lead is where you almost spoke to the doctor or really are close off possibly even getting where you feel comfortable that this could lead into a close. The next step is a concept that we have explored, really works well, is by start with one patient. So rather than telling them, you switch your entire office around, it's like saying, let me send you a sample. Let me send you the sheet, and you will see how easy it is. If you can just order the report, the test for one patient, you will get our color-coded report back. You saw the sample, and just see how easy it is and how helpful it will be for you and the patient. So it's that start with one patient concept that we could bring across. And our mailing and fax and email material supports that process. Then we have a simple get started page. So it's a simple page they can fill out to kind of show some kind of a commitment. Ultimately, there's a signature required on the document once they want to get the test kit, because there's a certain time involved on our side to onboard them, to set them up in the computer system, and then of course there's a cost involved, shipping out the actual materials and printing things with their labels and all that stuff. So we want to make sure that the doctor is on board, and there's just a little signature required. But again, that's all it takes, and then we can basically onboard them and answer some questions a few days later, if they have, get them on the phone and if you have any questions and all that stuff. So I will provide you as well, I would assume sometime next week, the end of next week, with a complete kit, so you kind of see what the doctor actually gets. I think that will be useful. All right, so let's jump into some of these details. Personalized approach. What every client is really looking for is help, right? So we need to understand that. If you can identify that need and then you meet it, then you're a problem solver, not a salesman. So we need to think of as a problem solver. The problem is they have patients that are dying. So what we need to find out is their hot buttons. What are their hot buttons? I kind of like to think about these three. If you find more that you can come up with, hey, share them with us or share them with me, great, or just work them on your own. But here are some that I would suggest to kind of hone in on. Number one is PGX testing is needed, better patient care, no ADRs. So again, on that need is, look, you have patients, they're on warfarin, you're prescribing some heavy medication. You really should, honor your Hippocrates oath and introduce genetic testing. Insurances pay for it. The patient doesn't pay for it. You have an obligation to do so. So that's maybe one hot button. Maybe they react to that. Somebody else might react to litigation, money. They treat this like a business, and they're realizing, shit, if I have some litigation, even if the patient didn't die, but maybe really got sick, and we saw the numbers earlier, you can scare them with litigation. I will try to find certain cases. I just didn't have the time to go down that path yet, but there may be some interesting things that we could add into it. It's like, hey, XYZ sued XYZ doctor in that state and blah, blah, blah. So I always like to kind of handle some of these hot button issues when you bring it up. Why? With some facts. For example, back to point one, PGX testing. What we could do is, for example, and I have these reports, like really good medical reports and abstracts and stuff that are part of that email and fax campaign already, just for your information. All right, let's jump back to number 4 to number 3. Insurances do pay for it. Let's bring that point across. As I said earlier, we heard many times, well, insurances do not pay for it. Yes, they do. We are with a special group. Our pharmacogenetic testing is fully covered. All right, and then of course that should lead into the point of that you need to establish a trusted relationship. By us supporting and helping you with good support documentation that gets sent to the doctors, you will have control of triggering instantaneous faxes and emails. I will walk you through that as well. So let's jump to a little bit deeper into that. So our automatic information campaign consists of email, faxing, and a mail campaign. So we have documents like that. We're sending out faxes like this, and also nicely formatted in email form. So what you need to do is now contact the doctor, try to get through the gatekeeper, and qualify the leads. What are these leads? Are these hot? Are these warm? Are these cold? Are these dead leads? And simply mark them. Then, of course, that would present like it's consistent follow-up. We need to create, your persistence on following up and filtering out what makes sense. You need to use your own logic. Where do you want to invest your time? Eventually you might spend more time in follow-up, but probably until you have a good 500, maybe 600, 700 leads worked on that are kind of like cold, warm, hot, where you kind of went through, you probably have enough to work with to kind of nurture that, and then really almost, I would say, exponentially can sign people up. So I encourage you to hang in there. I know that, maybe don't get frustrated if nothing really happens in the first 1 or 2 weeks, but, sometimes it just takes that 3rd or 4th week to maybe then finally kick them over the edge. It's like in marketing, it's repetition. It's this consistent follow-up that is needed. So again, a little bit on the start with one patient approach to close. Again, focusing on that one patient, bringing down that barrier of saying, hey, look, don't think of it like changing your entire infrastructure. If that's, so to speak, a little bit on there, and they're saying, well, we have no time, we're busy. Say, look, let's start with one patient. Let me send you the package. Let me send you the instructions so you see how easy it is. Why don't you just test it out on one patient, get a report back, and you'll see how beneficial it will be for the both of you. So we have a simple get started form, just a couple of fields to fill out, and then the signature of the doctor, and that's basically all we need to get the account set up. I want to talk to you about a little bit about the testing cycle. This goes maybe into some areas that we're not clear yet, but I just kind of wanted to quickly fly over that. Physicians agrees to test patients. So so once they come on board and test the patient, now we're setting up the account. Needs to be completely filled out along with the physician's signature. Now the account rep sets up training for the clinical staff. Of course, I will be there for you and with you at the beginning. There's no question about it. So this is something we can handle together, and I can take over if there's any questions. So the kits are shipped from the lab to the clinic or the account rep. Well, we usually will ship it directly to them, so there's nothing that we have to worry about mailing. The patient is tested, the kits are sent back via FedEx. It takes about 2 days. A session takes place and the testing begins, paperwork is started. If there's an issue during a sessioning, the clinic and account rep will be contacted. I don't think we will be contacted, they just write it in there. Testing begins and the results are ready in 3 to 5 business days. Physician results portal. The physician actually can log in and get all the test results directly there, and the sales portal will be active.